Brainwaves, a window to the brain. There are 5 primary brainwaves: delta waves, beta waves, theta waves, alpha waves, and sensorimotor rhythm. A non-invasive diagnostic tool that allows us to measure the different brainwaves, such it provides a window to the brain and how well it is functioning. Brainwaves tell us how different areas of the brain are communicating. Each of the 5 different brainwaves is associated with a particular state of mind. For example, when your brain is externally focused and alert, the brain is producing beta waves. When the brain is calm and relaxed, it is producing alpha waves. Brainwaves and mental states. Delta waves are produced during stages of deep sleep, and they are associated with the production of human growth hormone, which is necessary for growth, healing, and tissue repair. If a person's brain is unable to produce delta waves, then a deficiency of human growth hormone may result. This can lead to conditions such as fibromyalgia, tension headache, migraine headache, insomnia, and chronic pain. Theta waves are associated with a twilight state of mind. These waves are produced when your brain is falling asleep. These waves are associated with memory retrieval and creativity. However, when they are produced at inappropriate times, such as when a child is trying to concentrate in class, these waves may be associated with inattention and lack of focus. Over 25 different research studies have demonstrated that children and adults with ADHD produce unusually high levels of this wave. It has been suggested that measuring theta wave levels is the most accurate method for diagnosing ADHD. Alpha waves are also known as the meditative brainwave. This is because when a person meditates, the brainwaves shift to alpha. Alpha is associated with relaxation, calmness, and a sense of well-being. Alpha is associated with the ability of the brain to enter deep sleep. If a person's brain produces unusually low levels of alpha, then it will be impossible to enter delta sleep, a disorder known as insomnia. This finding has also been linked to conditions such as hyperactivity, migraine headache, tension headache, and fibromyalgia. These are the brainwaves. Sensorimotor rhythm are the brainwaves that are produced when a person is completely still and focused on one particular task. For instance, the Olympic high diver standing atop of his diving board just before the dive, or the golfer standing perfectly still just before his swing. Those are 2 major examples of when the brain is producing SMR waves. The ability of the brain to produce high levels of SMR has been linked to decreased hyperactivity and an increased resistance to seizures. Several studies have shown that increasing levels of SMR may reduce grand mal seizures in epileptics by 70%. In addition, teaching a person to produce more SMR can help alleviate symptoms associated with ADHD. The brain produces beta waves when the individual is alert and externally focused. Established research studies have demonstrated that children and adults suffering from ADHD produce low levels of beta waves. This finding may help explain why these patients are unable to stay focused on certain tasks. On the other hand, if the brain produces too many beta waves, the individual may become hyperactive and anxious. Summary of brain waves and mental states. Well, delta waves are associated with deep sleep, human growth hormone production. Theta waves, twilight. Alpha waves, meditation and health. SMR, extremely alert and perfectly still. And beta waves, problem solving, focused, alert, and concentration. Neurological dysregulation. Dysregulation of brainwave patterns. Neurological dysregulation refers to the inability of the brain to regulate itself. This results in miscommunication within the brain and the production of abnormal or atypical brainwave patterns. This condition may be caused by poor nutrition, emotional or physical trauma or stress, drugs and toxins, or a subluxated spine. Neurological dysregulation is associated with ADHD, migraine and tension headache, insomnia, fibromyalgia, and chronic pain, as well as many others. It has also been shown to be a factor in Parkinson's, autism, and Asperger's syndromes. Dysregulated patterns and associated conditions. Conditions related to dysregulated patterns. Each condition has an associated dysregulated pattern of brainwave activity. The initial BrainCore EEG evaluation will identify these dysregulated patterns. Over 30 years of university-based research has demonstrated that the brains of children and adults suffering from ADHD produce too many theta waves and too few beta waves, resulting in an inability to concentrate and pay attention. In some cases, the individual may become hyperactive to compensate for the lack of focus. BrainCore therapy is a drugless, non-invasive procedure designed to reverse this abnormal brainwave pattern through neurofeedback training and reduce or eliminate the symptoms associated with ADHD. Migraine and tension headaches. The brainwave pattern of people suffering with headaches typically demonstrates low levels of alpha waves and high levels of beta waves. This pattern causes the brain to become hyperactive, making it more susceptible to environmental triggers that spark the onset of a headache. Migraine tension headaches. BrainCore therapy is a drugless, non-invasive procedure designed to reverse this abnormal brainwave pattern and reduce or eliminate headaches by calming the brain, making it less susceptible to triggers. Insomnia. Studies show an increased mortality risk for those reporting less than either 6 or 7 hours of sleep per night. One study found that reduced sleep time is a greater mortality risk than smoking, high blood pressure, and heart disease. BrainCore therapy is a drugless, non-invasive procedure designed to reverse the abnormal wave pattern associated with insomnia, thereby allowing the brain to comfortably move into deep sleep and reduce the risk of developing a serious medical condition. Chronic pain and fibromyalgia. Research out of Canada in the mid-1970s demonstrated that these conditions are linked directly to an inability to produce delta waves during sleep states. This irregular pattern of brainwave activity results in the conditions known as fibromyalgia and chronic pain syndrome. BrainCore therapy is a drugless, non-invasive procedure designed to reverse the abnormal brainwave pattern associated with fibromyalgia and chronic pain, allowing the brain to enter delta sleep and eliminate the symptoms associated with these debilitating conditions. Other conditions related to dysregulated patterns: autism and Asperger's syndrome, depression, learning disorders, dyslexia, tics, and Tourette's syndrome. Memory loss, chronic fatigue syndrome, some cases of traumatic brain injury, some cases of paralysis, panic and anxiety disorders, and post-stroke syndrome. The possible causes of dysregulated patterns are subluxation, emotional and physical stress, trauma, drugs, toxins, and poor nutrition. The BrainCore neurofeedback system, the training the brain to produce normal brain wave patterns. The BrainCore training sessions. While an EEG report is correlated with patient symptoms and a protocol is selected, neurofeedback sessions are then begun. The feedback may be in the form of a DVD, Pac-Man, puzzles, and others. What we do is we give you a complimentary BrainCore EEG evaluation to determine if in fact there is a dysregulation and what your particular specific protocol would be.